So why full arch dentistry? I wanted to start with this slide and just talk about, I mean, if you don't think comprehensively, you're not going to get to full arch dentistry. You have to think comprehensively. Like if you're going to take a patient, you got to get beyond just one track mind and focus on one thing, but you got to get the photos in front of the patient and you got to have all their information, talk to them about not just their caries rate, but you got to talk about everything. Ortho and occlusion. I bolded this because we miss this so much. You know, we talk about their perio and their caries, but their bite is all jacked up, and we just got to get beyond that. And sometimes when you think about, okay, if I fix, you know, their caries, their perio, their endo, put a missing tooth in every spot, and fix their occlusion, and made it cosmetically beautiful, if you were to do that all individually on a lot of these cases, it's just beyond what's really feasible and realistic, maybe, you know, from a time standpoint, from a cost standpoint. And that's where full arch implant dentistry or all-in-X sometimes is the solution. We're going to use LaToya as our example today. We're going to design a case for her. We're going to use her hybrid that she actually has in her mouth. And we're going to go over it. And a lot of you guys go, why would we ever do an all-in-X on this patient? As you see, as you guys see her cone beam, you'll see she's actually got severe perio. Doesn't really look like it from the surface, but she's got severe perio, and her ortho and occlusion is actually a super difficult case. We're going to put her face scan in, and you'll look at it, and she's got a reverse smile curve, and you know her posteriors would need to be intruded. And you go, okay, if I even could fix all her perio and her ortho and her occlusion, and she hates her teeth and her smile, and so all that lined up, and it was full arch dentistry was the solution that we ended up going with for her. So the point of this was to think like, it doesn't have to, you know, don't just wait for that case that's like all the teeth are just falling out of their mouth before you finally talk about full arch dentistry, but think comprehensively, look at all aspects of dentistry. And can you fix that predictably with keeping their teeth? If you can, then great, that's the way you should do it. But a lot of times to get there, it's not going to happen without a clean slate. And future needs too. You know, what got them here in the first place, and what does the future look like? You know, if you predict where that patient's going to be in 10, 20, 30 years based on their current situation, you know, what does that look like? Okay, so we're going to do all-in-X. We're going to do full arch dentistry for a patient. Patient selection is key. I mean, you guys hear that with all cases, you know, cosmetic cases, restorative cases, but it's really, really important with all-in-X because you're marrying this patient. You know, they may be a patient for life. You know, this is a relationship that isn't just a turn and burn. You know, you've got to be there to take care of this patient. And that's not to like scare anyone away from doing this, but just, you know, pick your patients appropriately. You know, if there's somebody that's like, hey, you had better make this perfect first time and I want to be done in, you know, 6 months or else, you know, you probably don't want to touch that patient. So expectations are really, really important. I love to think about two moments in time with our patients. There's the, you know, the moment where you're, you know, you're presenting treatment, you're going over options, you're talking to them, and they close, right? They actually say, I want to go, and they actually pay the money. And then there's the moment when you actually start the dentistry. So a lot of times that's maybe like a 2-week window in these cases. You know, you collect the money, you're setting everything up, you're getting all the cases on, and then the surgery's here. Before you close the case, you want to kind of talk about, hey, everything is happy and dandy and everything is great and going to be amazing, right? Because you want to close the case. You want to get the patient to say yes. And you don't want to sit all these potential negatives that all of a sudden they're like, well, I don't even know if I want to do this because you're scaring the crap out of me. But that window of time after the case is closed, before you start, is then when you sit down with the patient. I like to sit down and say, hey, Mrs. Smith, you know, we're about to enter into this. Like, here's the potential things that could happen. Know that we're going to take care of you. Whether we need to make 1 temporary, 2 temporaries, you have an implant fail, we're going to replace it. Like, you're going to be taken care of. But you just kind of lay out, like, here, all the possible expectations. I like to do that after the close, before the case is started, because, you know, you're not going to lose the case, but you also haven't started the case, and then you just build that relationship. So that's kind of how I like to do it. All in X can be stressful, time consuming, especially for the beginner. You got to understand basic surgical skills. I think everyone's placing implants, so you guys kind of know what can happen with implants. With All in X, you got to have that basic knowledge to be able to troubleshoot and get in there. And the method that we're going to talk about is kind of that slow, predictable workflow that is going to kind of break things down sequentially.